Halo Sobat Tekon TV. Siapa nih di antara kalian yang suka mendengkur atau mengorok pas lagi tidur? Mungkin mendengkur terdengar seperti hal yang lucu ya. Tapi jangan salah, menurut dokter spesialis THT, mendengkur bisa jadi gejala kondisi penyakit serius yang harus segera ditangani. Terus gimana sih ceritanya seseorang bisa mendengkur saat tidur? Sebelum lanjut ke penjelasan dokter spesialis THT berikut ini, tekan tombol subscribe dulu yuk. Jangan lupa lonceng notifikasinya dinyalain juga ya, biar tetap update video menarik dari kita.
Snoring occurs, it is actually a sound, okay, that is produced by vibration of the soft palate. So the picture on the left, you can see a very, very typical photo of a patient who snores. This is a photo taken into the oral cavity. You can see that the soft palate, where my arrow is very, very low and almost behind the tongue. Okay, there is not really any space behind the throat. Okay, so can you imagine if this is an upright sitting up photo, and when you lie down with gravity, okay, the tongue normally rolls back and the tongue would be lying on the soft palate. Okay, so for you to breathe well and to have this column of the air from the nose to the back of the throat, okay, it has to go through this resistance. So the sound of snoring is actually produced by the vibration of mostly the tongue, the back of the tongue and the soft palate, okay? It can be quite a problem when it's very loud, waking oneself up, or even causing social issues or even issues to your spouse.
Kalau begitu, gimana ya caranya kita bisa tahu itu ciri mendengkur yang berbahaya dan bukan? Kapan orang yang suka mendengkur harus segera periksa ke dokter? Begini jawaban dari Dr Sue Rene, spesialis THT.
These are some of the symptoms that you should look out for. If your snoring gets louder, it's commonly over many, many years and associated with the following night and day symptoms. If you find yourself choking, or if your spouse or your bedtime partner actually notices that you stop to breathe, what we call witness apneas or gasping episodes at night, you actually wake up, okay, you don't know why you wake up, you're experiencing disrupted or fragmented sleep. You find yourself toileting quite often. This symptom is called nocturia, okay, and you wake up feeling very, very sleepy in the day, okay, as if you have not slept before. You have a morning headache. You can't concentrate well on your work. You may find that your blood pressure is actually increasing in the morning after you sleep, okay, and you do need your afternoon naps, and you feel really, really tired as if you have not slept before. So these symptoms may not be just snoring, okay? You may be suffering from a condition called...
Masih telah menonton video ini, jangan lupa subscribe channel Tekon TV. Share video ini jika kamu mendapatkan manfaat darinya. Terima kasih.